Hello, I'm Basil. I'm a neurologist, and let's talk MS. So MS is a neurological condition where your immune system makes an error, and instead of attacking viruses, it starts attacking the myelin sheath, which is the covering that covers the axons, or the wires that allow brain cells to communicate with each other. Those brain cells are present in your brain and spinal cord, and therefore MS can present in different ways depending on which part of the nervous system is affected. And some people can cause transient visual loss lasting for weeks, or can cause numbness or weakness. Usually the symptoms last for weeks and days rather than few seconds or minutes, which we all experience actually. So I must say, linked in with this, I spend probably equal time diagnosing MS as much as telling people that actually they do not have MS, and just to give them that reassurance. Nevertheless, I think it is important to diagnose MS as early as possible, because there are now medications available that aim to reduce the amount of inflammation or prevent the accumulation of further attacks or lesions in the nervous system. And hopefully that is going to prevent further disabilities from happening. So with that said, I think it is important to try and diagnose MS early. That will involve physical examination. We arrange scans called MRI scans. We may have to do an investigation called a lumbar puncture. All of these to facilitate identifying or confirming the diagnosis. Also important to come up with a diagnosis, because then patients will have an explanation for their symptoms, and they can plan and try and do something to prevent the condition from progressing. There's an excellent team in the community with a specialist nurse. There is input from physiotherapy, occupational therapy. Your work may be able to adapt and adjust to your needs, as well as a lot of symptomatic treatments for any pain or numbness that people have. Also, it's an opportunity to do lifestyle changes like eating a healthy diet, keeping physically and mentally fit, stopping smoking, anything that can damage the nervous system, to increase that reserve, so to help your nervous system deal with MS and to live with MS well. So that's, I think, the main objective in the long term. And also just to explain that MS is a heterogeneous condition. It can present very mildly, and so patients, you will not identify or even know that they've got MS. And unfortunately, there are people who are quite disabled that you may see in a wheelchair. And hopefully with the medications being available and being used early, we're preventing patients from developing or reaching stages that are kind of advanced. So I think identifying MS early is definitely an important step forward.